Welcome to This Explainer. Today, we're taking a scientific, professional, and honestly, a super reassuring look at the anatomy of penile curvature. If you've ever felt a little anxiety about this topic, well, you're absolutely not alone. Our goal today is to clearly distinguish normal anatomical variation from actual medical conditions, using the best available medical science. We're going to look closely at how the body works, what different symptoms really mean, and give you the facts you need to truly understand your own health.
So, let's dive right in and tackle universal, totally anxiety-inducing assumption that a healthy penis has to be perfectly straight during an erection. Because discussions about male sexual health are often kept quiet or considered taboo, a lot of guys assume that any bend or curve is a red flag for a serious disease. They hop online, find a bunch of inaccurate information, and understandably become completely overwhelmed. But guess what? Medical science tells us a very different story.
To give you some peace of mind, here is our agenda for today. We'll cover the anatomy of an erection, normal variation versus disease, congenital versus acquired curvature, busting common curvature myths, fertility and function, and finally, exactly when you should see a doctor.
All right, Section 1, Anatomy of an Erection, and how the mechanics actually work.
Before we can figure out why a curve happens, we really need to understand the precise biological engineering that makes an erection possible in the first place. The internal anatomy here is highly specialized. The shaft is primarily made up of three cylindrical bodies. Two of them, called the corpora cavernosa, sit side by side and are responsible for producing rigidity. Right underneath them is the corpus spongiosum, which surrounds the urethra and stays a bit softer to allow for ejaculation. But the real star of the show here is the tunica albuginea. This is a remarkably strong layer of connective tissue that surrounds the corpora cavernosa. During arousal, blood rapidly fills these chambers. The tunica albuginea stretches outward, compresses the veins that normally drain the blood, and effectively traps it inside. Now, for a perfectly straight erection, this tunica has to stretch outward completely symmetrically. Think of it like this brilliantly simple analogy. Imagine inflating two identical balloons inside a sturdy fabric sleeve. If both of those balloons expand equally, the sleeve stretches symmetrically, and the entire structure remains perfectly straight. It is a really elegant piece of biological engineering.
But here's where reality steps in, right? If one side of that sleeve just can't expand as much as the other, maybe it's a bit shorter or a little stiffer, the whole structure is going to bend toward that shorter side. Because the human body is rarely perfectly symmetrical. I mean, just like one foot might be slightly larger than the other or one shoulder a bit higher, the penis often displays minor anatomical differences too. Tiny variations in the elasticity of that connective tissue or the length of the erectile tissue itself will cause the penis to gently curve. It's exactly like our balloon and sleeve analogy.
Moving on to Section 2, Normal Variation versus Disease and the Medical Threshold. This brings us to a really huge concept in sexual medicine, figuring out the difference between a harmless, lifelong anatomical trait and an actual progressive disease. The magic number here, 20 degrees. Medical studies show that a significant proportion of completely healthy men have some degree of penile curvature during an erection. Urologists generally consider a curve of less than approximately 20 degrees to be a mild, totally normal anatomical variation. It's not a pathology, it's literally just how the body is built.
So, what does a normal curve look like? Well, it's mild. It might point up, down, left, right, or even have a slight rotational twist to it. But what really matters is what it doesn't do. There's no pain during an erection, it doesn't mechanically interfere with intercourse, and crucially, it doesn't get worse over time. If your curvature meets these criteria, it generally requires absolutely zero treatment. It is simply a natural part of how your unique body developed.
Let's hit Section 3, Congenital versus Acquired Curvature, which is basically the diagnostic fork in the road.
When urologists evaluate curvature, they immediately split it into two completely distinct clinical pathways. On one side, we have congenital curvature. This is something that's been present since the very first erections during puberty. It's simply a developmental difference where one side of that tunica albuginea just grew a little shorter. It's stable, it's painless, and there's zero scar tissue. On the flip side, we have acquired curvature. This develops later in life, after years of having previously straight erections. You might notice a gradual bending over several months. Acquired curvature demands medical attention because it represents a new underlying disease process, and importantly, it involves the formation of scar tissue. The most common culprit behind that acquired curvature is something called Peyronie's disease. Unlike this congenital differences we just talked about, Peyronie's disease involves the active formation of a hard scar tissue, often called a plaque, right inside that crucial tunica albuginea layer. This plaque acts exactly like a rigid anchor. It physically prevents that side of the tissue from stretching during an erection, which actively pulls the penis into a curve. And while it's often associated with older men due to cumulative tissue changes, it can absolutely happen in middle-aged or even younger adults too.
What's really fascinating, though, is looking beyond Peyronie's at the other causes of acquired curvature. We've got direct causes, like physical trauma or a penile fracture, which, by the way, requires emergency surgery, or even previous reconstructive surgeries. But look at these systemic issues. Diabetes mellitus impairs blood vessel health and wound healing. Smoking reduces blood flow and increases oxidative stress. There's even a known link to Dupuytren's contracture, which is a condition that causes scar tissue in the hands. This brilliantly illustrates how a genetic predisposition to abnormal scar formation or systemic health issues can directly impact your penile health.
All right, Section 4, Busting Common Curvature Myths, Fact versus Fiction.
It is definitely time to dismantle the myths that cause guys so much unnecessary shame, guilt, and anxiety. Let's be totally clear. Medical science unequivocally shows that everyday habits do not cause permanent penile curvature. Masturbating in the usual manner does not bend the penis. Sleeping on one side, wearing tight underwear, or carrying the penis in one direction inside your clothing, none of this will permanently alter your anatomy. These are simply decades-old rumors that stick around because men naturally look for an explanation when they first notice a curve. You can officially let these myths go. So, if your everyday habits are perfectly safe, what is the actual mechanical risk? Well, it's microscopic trauma. During vigorous intercourse, if the erect penis accidentally bends aggressively against a partner's pelvis or pubic bone, tiny microscopic injuries can happen within that tunica albuginea. Now, in most men, these tiny injuries heal up perfectly normal, but in susceptible individuals, the healing response goes somewhat into overdrive, leading to excessive collagen and scar formation. Modern research focuses heavily on how genetics, inflammation, and immune responses cause some men to heal with this pathological scarring, which eventually leads to Peyronie's disease. Let's move to Section 5, Fertility and Function, and Reassuring the Facts.
We really need to address another massive source of anxiety, the total fear that a curved penis automatically ruins a man's fertility or sexual function. The reassuring truth here is that mild penile curvature has little to absolutely no effect on sperm production, ejaculation, or fertility. It also doesn't cause erectile dysfunction on its own. Unless a congenital curve is incredibly severe or an acquired curve like Peyronie's disease progresses to the point where intercourse is mechanically impossible, your fertility and your natural erectile function are completely preserved. The curve itself doesn't break the machinery, so to speak.
And finally, Section 6, When to See a Doctor, the Clinical Checklist.
We want to empower you with the exact same framework urologists use to evaluate this. This is the final step in understanding your own anatomy and knowing exactly when you should take action. If you ever sit down with a doctor, these are the exact questions they're going to ask you. Did this curve appear recently, or have you had it since puberty? Is it stable, or is it actively getting worse month by month? Is there any pain when you have an erection? Can you feel a hard lump or a plaque beneath the skin? And does the curve actually prevent you from having intercourse? If you're experiencing sudden onset, pain, a worsening band, or you notice a hard lump, those are the clinical signs that mean it's time for a professional medical evaluation. Please don't rely on internet myths, rely on these clinical indicators.
Our source material sums this up beautifully. It says, penile curvature exists along a broad spectrum ranging from completely normal anatomical variation to medically significant disease. By recognizing that spectrum, you can clearly separate harmless, natural asymmetry, which requires zero treatment and definitely zero anxiety, from an acquired condition that actually needs medical care.
Which leaves us with a pretty fascinating medical mystery, right? What exactly happens at the cellular level when normal tissue repair goes wrong and turns into pathological scar formation? How does that hard plaque actually develop and alter the anatomy over time? Well, we are going to explore the mechanics of that exact process and dive deep into Peyronie's disease in the next part of our Explainer series.